We've had some fun exploring robotic surgery. Now it's time to take a deeper dive with Dr. Geocaris. So first thing, let's start high level. What is robotic surgery? I think a lot of people might wonder, do robots actually do the surgery?
That is a great question, and probably the most common question I get from my patients. Are you actually doing my surgery? So the Da Vinci robot, which we have behind us, it really is a computer interface that allows the surgeon to do a laparoscopic or minimally invasive surgery with smaller instruments. The surgeon is actually controlling the instruments from a console that's in the room, and the instruments have a wrist that can move like your hand. So this is allowing us to do more meticulous movements and dissections doing our procedures.
So no robot doing the surgery?
No robot doing surgery.
Okay, very, very good. Can you give us an example of some ways that you might use the Da Vinci system?
So any case that we traditionally would do what's called laparoscopically or minimally invasive can be done on the Da Vinci robot. For instance, a hernia surgery, removing part of your colon, or taking your gallbladder out would be some examples of the ones I do most commonly.
Okay, those are really good examples. I think some that, like you said, people get more often, right? Mm-hmm. Okay. All right, ThedaCare has achieved some impressive results through our robotic surgery program. Can you just highlight some of those for us?
We have had a great few years. The general surgery department has really taken all-in approach to robotic surgery and converted most of our service lines to robotic. So the colorectal service line, which is removing part of your colon for colon cancer, is 100% robotic, in contrast to the rest of the country where it's only 50%. The other area where we've gone 100% robotic would be our bariatric or weight loss surgery. We've had incredible outcomes in both of those areas where we've been able to cut days off of the length of stay in the hospital.
Wow, and we're going to talk a little bit more about the important piece of this for patients in just a moment. So I like how you're talking a little bit about that now. So it's very important for us. So not only do we have experts in robotic surgery, you and other ThedaCare surgeons actually train people from around the country.
We are committed to education and teaching at ThedaCare. Surgical Associates of NINA has residents from University of Wisconsin-Madison come and they learn their robotics from us, in addition to PA students from Marquette University. Dr. Georgian and myself do what's called case observation sites, where we bring in surgeons from around the country who are learning to pick up this skill in robotic surgery.
That's incredible. And I've sat in on some of those sessions where you have those surgeons coming in, and it's really neat just to see how ThedaCare is leading the way in that program.
Absolutely. We're definitely trying to elevate the level of care throughout Wisconsin and the rest of the United States.
Really cool. So finally, let's talk about what this means for patients. Can you talk about some of the benefits of robotic surgery?
You know, laparoscopic surgery has been around for a long time, where we make small incisions and less pain, and people have heard about that. So this is allowing us to do more surgeries, more complex surgeries laparoscopically. So you're going to have a smaller incision, less pain, quicker back to work, and less time in the hospital.
And so it's probably helping patients make that decision to get the surgery that they need because they won't be down for longer.
Absolutely. Nobody wants to take a month off of work. When you're having a robotic surgery, the time off of work is usually more like a week or 2 weeks rather than 4 or 6 weeks with an open procedure.
All right, Dr. Geocaris, thanks so much for being with us. Really great insight to our robotic surgery program.
Thank you so much for having me.